They say everything stands and falls squarely on the shoulders of leadership, and 2020 has given us all a reason to run around. And today we are sitting with many cases of uncertainties, 2021, and most importantly, the frustration that comes with the aftermath of the announcement of the COVID-19. Most importantly, the people that had felt the most brunt are those that are referred to as the frontline workers, and things have not been easy. And today I'm having an honor and a privilege to be sitting with Nalukhanyo Mnisi, who happens to be a registered nurse based at SS Gida Hospital in Case Kamahuk in the Eastern Cape. Welcome to it, sir.
Thank you so much, sir.
How is it going?
I think all is good.
I wish I could be saying that it is a pleasure, we are excited, we are jubilant, but we are still under COVID-19.
Yes.
How much of a strain is this to the nursing profession?
It's so much of a strain to a level that even nurses are now dying.
I have reason to believe that we hear from the news, we hear the statistics, we see on the news daily. But as a person who is not in the profession, I'm sure, very much sure, that the picture that I have from the second-hand information is not nearly close to what you guys are going through.
It is not. I'm 100% sure that it is not, because we struggle every day. We try improvising every day. We try helping people every day, but the resources aren't there.
And as part of our earlier conversation, we were talking about some of the frustrations that you guys are having, besides just the amount of work that is now all of a sudden piled over you, but also the resources that you guys have to work with.
Yeah, every day we are being told that a certain thing that we have been using is not properly safeguarding us as it is set out to be. Making an example, the KN95, we still receive KN95 masks, but it is said everywhere we go that the masks do not cover us from this killing virus.
We are where we are today, you and I, and I'd like to believe that not so long ago, I think a day ago from today, the Special Investigative Unit in South Africa, the SIU, had just released a report of the corruption that had happened with regards to the procurement of the PEE in such a time, and a lot of the PEEs were actually overpriced, and therefore it became a bit of a trouble and a challenge to get PEEs to the hospitals and stuff like that. What has been your experience as a nurse that is stationed at the place where you're stationed?
In our hospital, we struggled. When the president declared COVID-19 as a disaster in South Africa, March last year, 2020, we struggled in our hospital, I won't lie. It was difficult inside out. We never had proper protective clothing according to the protocols. We actually had it after months. Wow. After the declaration of the state of disaster in South Africa on the 27th of March last year. We had it months after proper PPE. It was very hard because, one, we understand that we are in rural, deep areas, so it's not easy, but at the end of the day, it's our lives. This thing is killing people who are supposed to be prioritized, even mostly us as healthcare workers, because we are the ones who are going to receive this killing disease, or the patients with this killing disease.
Wow. And let's just backtrack a little bit. You have been at SS Gita from what year was it?
2017.
2017, and I'm made to believe, as things stand right now, you are the chairperson of DINOSA?
Yes, I am the chairperson.
How did that come up? How did that come about?
I was actually groomed by the previous chairperson to become a chairperson for the hospital, and also voted by the people, the structure also of the DINOSA, that I become the chairperson of DINOSA in the hospital.
And has this structure been able to sort of like help alleviate some of the challenges in terms of representing the staff to management? Has there been any progress in that regard?
We're trying our level best. One, to first represent the nurses of the hospital as a whole, even though they're not all affiliated with us, but we are the ruling union in the hospital. We tried our level best, and the management, it was hard. The management was never helping. The management kept promising, but never delivering. It was that hard. But at the end of the day, we were told that you're supposed to be on duty, or else you will have leave without pay, and you do not have an option but to go to work, even though you know rightfully that you are not properly safe.
And here's something that is actually quite, I'd say, very critical and very important. It was not so long a time since you had actually, being the chairperson of DENOSA, that
Yes.
we were hit with the bad news that COVID-19 has struck. At this particular point in time, there wasn't much information out there with regards to issues of protection and all of that kind of a thing. How did that really affect you as a unit, as a nursing staff at SSD?
It was very difficult because the nurses, one, they were never reassured about safety mainly. They were never reassured about psychologically we were not ready, mentally we were not ready, practically we were not ready, we're not even properly trained on how to even manage something of this nature. Mind you, we had to go to work and put in an effort, try assisting and helping people out there, because we are out to serve the community every day.
You said you were not properly trained, and my interest is this, and something that really, gets me very interested, is that at this time there weren't many people who were aware of what this disease is like and what challenges it is bringing with it. Yes. And because of that, we found ourselves in a situation where you still, as the frontline workers, as the nurses, still had to be there, report for duty and care for the patients. How did the communication go there? How did the, for lack of a better word, the agreement, the consensus to say, yes, we'll continue to go to work, but the assurity, the confidence that we are safe, how did that go?
Let me make an example about myself, just for you to get a picture. I was working in a normal ward, normal surgical ward. Then I was approached by managers that, will you kindly start early and work in PUI, we call it PUI, which is Patient Under Investigation Unit, a ward. Even though the ward wasn't properly well developed to handle things of this nature, because the ward was still under construction. There was dust everywhere, there was paint everywhere, because the ward was still under construction, but there were patients who were placed in that ward. One, because I'm a chairperson, I queried it to the management, because I know, one, it is said out that this condition is a lower respiratory tract infection, and this virus mostly attacks lower respiratory. So I queried it, why are we nursing patients in such environment? Because one, lower respiratory tract conditions are mostly affected by dust, are most affected by paint fumes, but we're still working. But I won't lie, because I love my career, because I'm out to serve. I made a vow, and having to say, I want to help the community where I can, whenever I can. I said, yes, I'll go work in that ward. I don't have a problem, because most people were anxious. They were not at ease about working for COVID-19, but I ended up going there. I worked in the environment, even though it wasn't conducive in accordance to the occupational health and safety guidelines and rules, but I ended up working there. Then that was it, because it's in my nature. I love the career. I love assisting people. I love being out there. I went.
We're talking with Mr. Nalu Panyo Mnisi, who is a registered nurse based at Sesingita Hospital in the Eastern Cape, in Case Kamahuk. Don't you go nowhere. We're coming back right after this.
The best way to protect yourself from 2019 novel coronavirus is to avoid being exposed to the virus. Additionally, there are preventative actions that you can take to protect yourself and your family from the spread of respiratory viruses that can make you sick. These include stay home if you're sick, cover your cough, and wash your hands.
Welcome back to it. This is JT Tebehadi here on Focus Media SA, and I'm still with Mr. Nalukanyo Nisi, a registered nurse who's based at SS Gita Public Hospital in Kamahuk in the Eastern Cape. And we are discussing the challenges that the frontline health workers have actually been made, to have to deal with, unbeknownst and unprepared for that. But one thing that is very specific and actually that really hit home was when we talked earlier on, and you said to me, then in April of 2020, you were unlucky. What does that mean?
I was unlucky. It haunts me till this day. As I did say earlier, I was working in PUI. I was approached by management and they asked me to work night duty in PUI. Fine. Basically, what happened is I went to work, ordinary day, going to work, received a report from the day staff, and I got an information that we possibly might have a confirmed COVID-19 client inside the ward. And I asked questions, how did that come about? How come you did not tell me earlier so that I at least know, because I'm a chairperson of DINOSA, but it did not happen like that. Fine. With that happening, I then did my own investigation just to find out more about this client that is set out to be a COVID-19. When I was getting the report, I was looking around, because normally when we give report, we go around to the patient one by one, and then we get a report. So when I got that report from my nurse, because my second in charge nurse, since I was the one in charge of the ward, gave me more information saying that, okay, this patient was set out to be a COVID-19 patient in gray. And I was like, okay, hold on. I just want to find out why are we nursing a COVID-19 in the ward?
Hang on just a little bit. So you say you were told that this patient, who is now at your hospital, which is SSG,
yes,
was a patient at another hospital.
Yes.
Can you join the dots there?
Okay, what happened is, when I was getting the report, I did my own research. Normally, that's what I do when I get transfers, so that I can know more of my patients.
Which is very important.
So what I did, I researched. I found out that the patient was basically an admission in Grey Hospital.
In King Williamstown?
King Williamstown.
All right.
Yes, Grey Hospital in King Williamstown. And that patient was then requested out by relatives after being confirmed that she is a COVID-19 confirmed case. So apparently the patient went home in Zwelicha, King Williamstown.
Not a PUI, but confirmed.
Was confirmed to be. Right. Apparently the patient was first admitted as a PUI in Grey, and then and was done the test, the COVID-19 test, and then they came back positive.
Positive, yeah.
Yes, and then that patient was DC home. When the patient was DC home, she then got sick at home. Apparently, the relatives decided to take the patient to other relatives in Dimbaza. So when that happened, it is normal to do that. We understand that maybe the other relatives are going to be able to care for the patient. Then apparently the patient got sicker in Dimbaza, and then was taken to Dimbaza Clinic. In Dimbaza Clinic, the patient was then transferred to my hospital. Since it's the closest hospital, they normally transfer patients to us. So normally, after you hear what is being said by the day staff and you are taking report from the day staff, you then go to the books and take history, do thorough history, because it was my first time seeing the patient, so I did not know the patients. When I was going through the book, I noticed, one, it's written PUI, meaning a patient under investigation, and then on the other chart, it's written COVID-19. And then it's not written query COVID-19, it's so that I can understand it's a PUI. It's written COVID-19. Inside the prescription, the doctor prescribed medication that is set out to be for confirmed cases
which if it was probably a mistake in terms of writing on the chart
Yes.
that maybe a person who was writing that chart was supposed to write COVID query patient, maybe just wrote COVID. But then now there is also a prescription
There's a prescription that confirms
that correlates with
the outside
positive
yes.
outcome of a COVID-19 test.
Yes.
All
so
right.
I then queried this, and then I tried even calling people like previous people who were nursing this patient, because apparently the patient came 2 days before I went on duty. So trying to ask, and then they were telling me how the condition of the patient was and everything. Then that's basically that. And then I noticed, I understand why. Then I also queried this because the patient was not in a normal isolation set out to be. That it's written linen room. The room that the patient was in is written linen room.
All right.
Yes, there was no linen inside, but was placed there. I value that. I always applaud the nurses who did that, because they were protecting the other patient to not interact with the patient. Yeah. So I understand. I then queried, do you guys know that this patient is a COVID-19? Apparently that information came on the day that I was on duty. During the day, and the doctor prescribed on that day the treatment for COVID-19. But the challenging thing that affected me most on the day specifically, one, I was unable to help the patient. How? When I saw, normally when I do my own rounds in the ward, I look at the patient and ask how you're doing and everything, just to find out how the patient is. Yeah. I went to the other patient. The patient did not have any complaints. I then, because I read, I just, okay, you know what? I can't enter inside because it's confusing to me, because this one sheet, medication sheet is written COVID-19, and then the case sheet is written query COVID. So I'm not sure whether it's a query COVID.
So the other one is saying that under investigation, the other one says confirmed.
Yes. Basically, that's what it said to me, because once the medication is for
and there's no way that you can actually make it a conclusion, except for doing the best thing that you can, that is now taking care of yourself so that you don't expose yourself.
I couldn't do anything because, one, I did not have anything to wear to protect myself in the ward.
In the ward, yeah.
On that specific night.
At this time, and I'm going to keep on interjecting on this one, because it's very, very important that I understand, that our viewers at home understand. The PEE, what is the state of PEE at this particular point in time?
It's PPE.
PPE, yes.
At that specific time, we did not have proper protective equipment.
And what was the reason for that?
Personally, I don't know, because they never came to us and said the reason we do not have PPE is because of this. They never gave us such a reason.
The reason why I'm asking you that specific question is because at this particular time you are, I believe, the chair of DINOSA.
Yes.
Which is actually the union that is representing the nurses. Part of the interest and what is within your scope of competence in that regard is to actually begin to take that to task, to say PEE is supposed to be priority. When you communicated with the management on this particular, what feedback were they giving to you?
They always tell me that we are still working on it. We have ordered, we have done everything that is needed to be done. They even reach a level of having to say, even the courier is coming. It's sent out by the depot, meaning the depot where they take the equipment. It's on its way. We do not know when it's going to take because of COVID-19, so it can take longer. And they even made a promise of having to say, you know what, give us a few days, it's going to be here.
So at this point in time, specifically at this point in time where now you are concerned about this patient that is in the linen room now, the level, what's the level of the PEE compliance?
It wasn't there. In my ward, personally, I even asked the day staff, but why am I not given protective clothing? And they said it wasn't there. And then I went to the donning and doffing room, whereby we put on our clothes and everything to look. When I entered, there was literally nothing. There was only boots. Though the theater cloth boots, there was only that. There were about 4 of them. You cannot wear that alone and say you're safe, because we're dealing with a high risk virus. So I immediately took an action because I'm supposed to do that because one, I cannot put my subordinate at risk and also put myself at risk. I called my manager for the day. After calling her, she told me, okay, fine. I don't know what is happening. And then I was like, okay, fine, ma'am. I'm going to wait for you. I'm only going to be able to take action and try to care for the patient only when I get the proper protective clothing. But because of the fact that I am there to care for the patient, I am there to nurture my patient and make sure that they get back to normal, I decided to take action. I went to see, just to check on the patient, if the patient is still okay and everything. When I saw the other one, there was nothing. The patient did not have any complaint. And then I went to this one that I'm told by the day staff that it's our critical ill patient. So I went in, I looked at the patient, I saw that the condition is bad of the patient. From that,
the one that is in the linen room.
Yes, the one that is in the linen room. I saw that the condition is bad, so I need to take action. I took action. I decided to put on an oxygen mask because obviously when the patient's condition is going down, like it's deteriorating, what you need to do is at least give that patient oxygen, proper oxygen, so that meanwhile you are still trying to figure out what to do, at least the patient gets oxygen because it's a lower respiratory tract condition. So oxygen is very essential for such conditions. Immediately after that, I rushed to the phone. I called the doctor. The doctor said, that patient is a COVID confirmed case. I cannot come there up until I get proper protective equipment. I then said, Doc, what should I do meanwhile? We are still trying because I'm also not having proper, I personally am not going to come because I am high risk. And yes, the doctor was high risk because the doctor during that time had her own personal problems.
To deal with,
so I called my manager immediately after that. From calling that manager, I then realized that even the manager is shocked that I do not have the clothes to wear, the protective clothes. I then noticed, okay, the manager promised me, you know what, meanwhile, I'm going to rush. I'm going to try and find out how to get you something so that you at least be safe. The manager apparently went to theater, tried walking around and all over to find keys for theater because it was at night. Normally in our hospital, theater doesn't open. So she walked all over around trying to find out where are the keys, and she luckily got them and then went in the theater.
Why run around looking for the keys? Isn't it supposed to be a given where the keys stay?
I don't know where the keys were. Where I really don't know. I really don't know. But she ended up getting them, and then when she was doing her round, she came with the clothes. It was a trouser, a normal trouser, like a cloth trouser and a top, and a theater cloth gown, and said, I can meanwhile wear this. I said, I'm going to wear them because I do not have an option, even though it's not proper protection.
So basically clothing. We're now patching now.
Yeah, we call it in our field of like improvising.
All right.
We call it improvising, so we're improvising. So we are given that. I couldn't still take action because now the action that I was supposed to take, at least I've taken it already. I've given the patient oxygen. Now I need instructions and way forward from the doctor. Then I decided, you know what, I cannot wait any longer. Let me go out rather, try communicate with the doctor and the manager. Went out, went to the doctor. We actually went out. I went to the doctor. I went out of the maternity ward with the doctor saying, Doc, I need to take action because this is what's happening.
In the meantime, as you're doing all this running around, you had already seen and observed that the patient
is going down.
Really
and we cannot take any action because we do not have proper protective clothing for a COVID-19.
Hold that thought right there. We're coming back just after this. Let's find out when the law now comes closer to a choice between doing what's right and doing what's right. Coming back right after this.
The best way to protect yourself from 2019 novel coronavirus is to avoid being exposed to the virus. Additionally, there are preventative actions that you can take to protect yourself and your family from the spread of respiratory viruses that can make you sick. These include stay home if you're sick, cover your cough, and wash your hands.
All right, welcome back to it. This is Focus Media SA. Best of you. JT is my name, and I'm still with Nalukanyo Nisi, and we're talking about this aftermath of COVID-19, and it seems like the plot thickens, and it seems it's getting even harder. I said before we went to a break, when you have to choose between doing what's right and what is right, the question is what is more right than the other. At this particular time, before we went to a break, Mr. Nisi, the patient's condition is deteriorating.
Yes.
You are faced with the toughest choice of your life, I could imagine.
Yes.
Can you take us through that?
The condition was going down, and I had no option but to take action. Then I decided, you know what, let me go out the ward and try to communicate with the doctor. Doc, can you at least come see the patient and give me a way forward? The doctor said, I cannot. So,
if the doctor could not do anything, what is it that in your competence and in your ability to do anything at all, what is it that you could do?
I couldn't do anything besides having to give the patient oxygen meanwhile. And having to give oxygen does not guarantee that the patient is going to recuperate and be back to normal. But I need further actions, because the only actions I need to take is having to be doctor's instructions. So the doctor said, I need to come see the patient. The doctor wanted to see the patient, but the only thing that was restricting the doctor from seeing the patient is that there's no protective clothing.
The worst thing happened.
The worst thing happened. We called managers, we called CEOs throughout the night. We never got PPE. We later got PPE in the office, locked inside. So we couldn't get the key for the office. We had to call another manager, and the manager came from her house, from her room.
The PPE
was locked
in the very same hospital, but in the matron's office.
Yes, that's what happened. We then went inside the matron's office since we got the key.
Who's we, if I can ask?
It was me, the doctor, and the manager.
Okay.
The manager for the night.
All right.
We went in, and then we tried. It was a box with everything inside: masks, boots,
All right.
the gum boots. But the doctor still said, this is not proper PPE.
Sufficient.
And you cannot argue with the doctor, because the doctor also studied apparently how proper PPE is supposed to be, because apparently she did occupational health and safety. So she knows everything, and I cannot go beyond that. If she says it's not it, it's not it. So there was no action, and then we went with the manager, and I said to the manager, since you're saying you are also a high risk, since you've got your own comorbidity conditions, you can view the patient from the outside, because the linen room was also at a view, had a window that is outside to see, to also be able to see inside. So the manager saw, and the manager said, this patient is going down, is gasping and is going down. At about 9 o'clock, the patient passed. I could see that the patient is gone. The patient is not breathing. The patient, I don't see any chest movements. That's how we see that the patient is still breathing. I could see that the patient is not moving. Even the mask that I placed on the patient is not in its proper position, because the patient was gasping. I understood that the patient was gasping, but we couldn't do anything. Okay, fine.
Let me give you a time to catch your breath and
Okay.
just calm down a little bit. We're just going to come back. I'm just going to give him time to catch his breath, and we're coming back right after this, because this, as you can see, it's really something that's very practical. Some of the practical challenges that we never even think about when we're thinking about the frontline workers, the day-to-day challenges and the realities that they're facing and having to deal with. We're coming back right after this. Right, welcome back to it. This is Focus Media SA here on Best of You. I'm JT, and you're still with me and Mr. Nisi right here. Gave you a time to catch your breath. I hope you're feeling much better now.
Much better.
Right, we're going to take it a little bit forward to you. You have gone through. You just before we went to the break. You've had to deal with. Obviously, it's like some of the challenges that you're dealing with every day as a human being. You know, it cannot be hard to. It cannot be easy to actually be seeing a person in agony and in pain and in anguish, but it's that much harder when you have to lose a patient on top of that. And I can imagine the stress that it comes with to actually not even be in a position to do, you know, the best that you can do, because there are these limitations, and this regard the limitations of PPE, and obviously you could not take a risk of actually even exposing yourself. But as we are sitting here today, and this might be of interest, and this is what I was talking about when I was saying choosing between what is right and what is right. But the question is, what is right in terms of what, or in terms of what perception or perspective. You are here as a person that now had to be answerable for the passing on of the patient.
Yeah.
How does that come about?
Yes, the patient passed. Yes, they made a way to lay the patient. A few months after, I got a call from my shop steward that you are alleged, so you need to have a disciplinary hearing. I'm alleged of what? I'm alleged of what? Then he told me that this is what's happening, this and this and this and this. I was like, okay, fine. I don't see myself as having to have done anything wrong when it comes to that. But practically, I'll just tell everything that happened on the day. So I got reflected by the threats that I got when I was still fighting this PPE thing, meeting up with the managers, coming up with the top managers, district managers, and everything. That you forget that your future is in our hands, and your CV is always on my table. I can remove it whenever you like, whenever I like. Those were the threats that I got from the managers. So it came back to me. It reflected hard, and it was very difficult. It was a difficult time for me, because at work I wasn't comfortable.
Can I get this clear? Are you saying that there couldn't have been any basis upon which you could be held to be answerable for the death of the patients, that in actual fact this became a convenient way of dealing with you because of your union activities as the member of the union, and more importantly as the chairperson and leader and most active member of DINOSA in the hospital? Is that what you're saying?
Basically that, because I'm saying that because patients die in hospitals. Patients die like every day in hospitals. But specifically, now that there's this patient, it's not the first time having to have a patient dying when I was working. It wasn't the first time. I have been, for the past years, getting patients that die. But this time around, it haunted me, I guess.
All right. Just to get us very nice and clear, you were then hit with the allegation of professional negligence.
Yes.
The violation of Batupili principle.
Yes.
And the third one,
having to reveal information of the patient, violation of privacy and confidentiality, having to expose information of the patient and everything.
Do you think you were negligent in handling this?
I personally do not think so, because I took all the actions that I was able to take. Because the circumstances were not allowing me to take any actions further. because the only actions that I was supposed to take was the actions now that are coming from the higher, higher level, meaning the doctor and the managers. So I can only take actions coming from them. So
And when we talk about Bartopili principle, the violation of Bartopili principle, as a layman, as a layperson, I would think it means that you put your own personal interests before the interest of the others, before the interest of the most important, who happens to be their client or the patient in this particular regard. For lack of a better word, and just to make it as palatable as possible to someone out there, basically you were selfish.
yes,
Do
that's what they said.
do you think at some point you were selfish? Do you have any?
I don't think so. I personally do not think so, because I tried calling, I tried taking action, I tried going by my foot.
Would any other nurse in your situation not tried harder?
In my situation, because of the fact that there are guidelines, there are protocols, you cannot go beyond that, because if you do that, you're putting your life at risk. Yes, as nurses, we put our lives at risk every day. But now we've got this new pandemic that is a killer pandemic. We cannot risk it, because one, we lacked information when that was happening, and during that period, everything we're still learning about this virus, and it was hard. So I don't see any other nurse that they can have other actions to take besides the action that I took, because the action that I took is an action that I was supposed to take. You understand? And it's an action that I'm trained to take.
All right. And then there's the other charge, which is the third and last one, exposing the credentials or information of the patient.
They said
which in I think what we know, professional
violation
of
privacy
patient and
medical
practitioner confidence, yes.
confidentiality and everything. Yes, they even alleged me of that, saying that I went to the public and talked about the patient.
Did you go to the public and talk about any given to any distant level?
I did not reveal the credentials of the patient. I told them what happened. Like, I just told them that there was a patient. Like, you know what to say, but you know what to not say, because yes, I'm trained and I am a professional. I need to be professional in whatever thing that I do. I had to say, guys, I experienced this. With this, there was a patient. This is the history that I got of the patient. I never revealed the direct credentials of the patients. Like, you cannot mention patient's name, patient's how the patient was. You cannot paint a picture of how the patient is in public. You're not supposed to do that.
Who is the public that we are talking about?
One, it was the nurses. Apparently, they also said that there was also community members, because the nurses had a sit-in, and the managers were supposed to address us. Even the district managers came, the top managers of the department came. So they were supposed to actually be addressing us on PPE and why aren't we having the PPE in the hospital. So that's what they said.
Would I be right in assuming that that is the time or the context in which you then allegedly published or made known the patient's affairs?
Yes, that's the time.
All right. And just to be clear, what was the reason that you mentioned anything about the patient?
I was mainly sharing my a testimony of what I experienced, so that my other nurses get an idea of my experience and how it has affected me. I wasn't trying to get certain attention. No, I wasn't. The only thing that I wanted was that I wanted them to have an idea of the struggle that I had to face in order for me to give what I'm trained for, in order for me to render care and service that I'm trained and hired to do.
Was
by
it
the-
just a casual talk between you and a couple of members? Was it, you made mention of the sit-in of the nurses and you're
Yes.
waiting for the management. What was the setup like there?
We always had sit-ins, often because the managers would always say, we're going to come back with the information on
As
the
a form of
specific day."
protest.
Yeah, because we were waiting for them to say, okay, guys, we got PPE. Now you can go back work. Because you said, okay, let's say I make an example. Tuesday, we're gonna meet with you guys in the morning, and then we get PPE. We give you information and the updates on the PPE that we said we ordered, because they said they've ordered, it's on its way, the courier is coming. Only to find out they're also borrowing on other hospitals, trying to get PPE, in which that PPE was restricted because it was one box of approximately 20 gowns that is given to certain people in the hospital, not to everyone. So from there, I was fighting a losing battle, because whenever I say I go to the members and say the management is promising, guys, that we'll get PPE and all of us will be safe, so you can work. So I stopped having to do that, and I said to the manager, I hate the fact that whenever I'm having a meeting and I said to people that you are coming, the PPE is coming, I expose myself and having to be painted as a liar. As
So
a
you
leader
actually
that lies.
be
So I-
telling your members that this is what's going to happen,
Yes.
and then it doesn't happen. They look
Yes.
at you and say, "Hey,
You
but it
lied."
did not happen. What's
Yeah.
the story? Are you now
I was-
cahooting with the management?"
Yes, that's basically
How
that.
come you were actually finding yourself now having to face disciplinary action in this particular regard? Because then I would have thought, from what you have said, I would have thought this is the responsibility that actually falls squarely on the hands of the management and even to the higher powers. And at this particular time, as we're talking about this, post the passing on of the patient, the PPE was still not sufficiently adequate.
Yes, it wasn't.
So how is it that you were personally charged?
It's because I was an activist, I would say, because I was fighting so much that at least the nurses must be safe in everything. So I preached that to the management every day I met with them, every time I met with them, that yes, I understand that it's not easy for you to get access. Everyone is shocked. Everyone is not ready for this condition. But at the end of the day, we are the most ones exposed. And mind you, I always said this to the managers, you as managers are in the offices. We are the direct contacts.
The literal
Yeah.
front liners.
Yes, that's what I was always saying to the managers. But the managers never listened. They always said, it's coming, it's coming, it's coming. Then boom, I ended up being alleged, and then I was sent to disciplinary hearing. From that, I kept on going to the disciplinary hearing for them to discuss and have their witnesses that I did all these things and everything. From there, I got these allegations few months after finding out that the exact patient that died is actually an aunt of a top leader in the political parties. Yes. So apparently they are now wanting to do investigations, try to find out how did their aunt die, why did their aunt die like this and everything. And then boom, I got the allegations that it's all on you.
So basically, I would imagine as a family, I would actually be, if I had to take anybody to task, I would have to take the government, the
Yes.
Department of Health to task,
Yes.
and the Department of Health in this particular regard. And then it might not be that it happened that way, but basically this is at least how it appears on the face value, that then someone had to be pinned with the blame, and it came
was
to your
that someone?
desk.
Yes, I was that someone, and I was set out to be the one who
had done that.
who has.
What
killed
was the
a patient.
outcome of the disciplinary hearing?
I was found guilty, and I know there's a lot at risk now, because there's a high possibility that I can lose my job. There's a high possibility that I can be deregistered to practice. There's a high possibility of a lot of things, and I'll be losing what I love.
You said
And
you
I'll
said
be losing.
earlier on. Sorry about that. You said earlier on that you love your job, you love your work, but it seems like it has been very tough for you.
I pray every day. I ask God for strength, but since I'm guilty now, I don't know what else to do.
There are avenues that are available to you. You made mention of the fact that you were a member of and a chair in this particular district of Denosa. What is the position of your organization in that particular regard? Have you spoken with them? What is the extent of an engagement, if at all? Have you spoken to the
shop steward.
management? Have you actually talked to your shop steward? Have you appealed?
I haven't. I haven't spoken to the management. I spoke with my shop steward, and he's very supportive, and he's telling me that I will try my level best to at least maybe get a lenient verdict on what they want to do with you, and I'll try my level best. And we have appealed also. But I don't know. I'm living my life every day haunted. I'm living my life every day scared. And whenever I go to work, I'm ready for the news that are going to say you are no longer allowed to practice. You are no longer allowed to touch any patient, in which that will be taking away the most valuable thing to me, which is what I love doing. What I love doing. I love rendering service to the community. I love having to help. I love seeing my patients getting up and saying, you have helped me a lot. That makes me proud every day. So now I'll be losing that. And I know I'm not the favor of the management. I was told that several times, but the only thing that hits hard is the fact that I'll be losing what I love.
For us who are onlookers, who are sitting out there, we don't really have, the full extent of what you guys have to deal with. When I say you guys, I mean nurses and the healthcare workers in general, what you have to deal with. What is the situation now, generally, in as far as the call for the adequate provision of personal protective equipment?
Right now, all I can say, back then, it was hard. It was very hard. One of the things that I'm proud of is that at least it's better now. I fought so hard. We have fought so hard as nurses every day. It's not my hospital only. Other hospitals were doing the same. It's better now. It's better because we got sponsors. It's better because we get the supply of PPE now in our wards. We no longer need to chase managers for keys. We no longer need to work hard in order for you to be safe. Because at least now we've got access to those resources. So it's better now. That's what I can say.
I'd really like to appreciate you for your time and just having, given out this story as you have. I'm definitely sure that it couldn't have been easy to actually, go through, relive that particular experience. And all that I can say is that, look, and I'm not saying this to you only, I'm saying this to all the healthcare workers, the frontline workers who are really, just doing the best they can to give the best that they can to do, best, patriotic service to the people of South Africa. But just in closing, I want to believe that there is a silver lining at the end of this, and as you have said, you have lodged an appeal against that particular verdict. All that we can say is that may it come out positive, and may the best results of that particular appeal, prevail, so that the best direction and the best way forward can actually be achieved. Thank you ever so much.
Thank you so much, sir.
All right, that was Mr. Nalukanyo Mnisi, a registered nurse. Perhaps this would actually give us an insight as to the kind of challenges, the daily battles that the healthcare workers are having to deal with. I can tell you now that I know a bit more than I thought I knew before, and I hope we'll be talking again sometimes with greater and much nicer news. God bless you.